The question is that this bill be now read a second time. I call the member for Hughes.
Thank you, Deputy Speaker. I rise tonight to speak on the National Health Amendment Pharmaceuticals Bill of 2014. And it always is a great pleasure to follow the member for Wakefield and the absolute nonsense and rubbish and scaremongering that he continues to go on with every time he comes to the dispatch box. Okay. Now, the first thing we must correct, Deputy Speaker, is this repeated untruth that we hear from members of the opposition about cuts to health and education. The facts, Deputy Speaker, the facts are that this financial year, 2014-2015, there will be a 9% increase in health spending. Next financial year, Deputy Speaker, there will be another 9% increase on top of the previous 9. And the following year, Deputy Speaker, there will be yet another 9% increase. So 3 years back to back, we'll have 9%, 9%, 9%. Increase, increase, increase. And yet we have members of the opposition somehow concocting it in their minds that this is actually a cut. Now, the same thing applies for education, Deputy Speaker. We hear members of the opposition running around, scaremongering, especially students that have the great opportunity to go to university in this country, that there's these so-called cuts to education. Well, again, Deputy Speaker, nothing could be further from the truth. The facts are, this financial year, there's an 8% increase in spending on education from this federal government. Next year, Deputy Speaker, yet another 8% increase. And the following year, Deputy Speaker, yet another 8% increase again. So if members of the opposition, even though running this ridiculous scaremongering campaign about cuts that don't exist, if they think that this 9% and this 8% increase is not enough, it's up to them, Deputy Speaker, to articulate very clearly how much more above that 9% increase that they think our spending should go up. But most important, Deputy Speaker, where will the money come from? Where will it come from? We know, Deputy Speaker, they think that money grows on a money tree, or there's some money tree out in the parliamentary courtyard. They have to explain to the Australian public where will the money come from. Is their plan just to continue to borrow and steal from our children's future and run up debt that not only has to be repaid sometime, but the interest costs have to be serviced along the way? Now, getting back to the bill, Deputy Speaker. This bill addresses a few issues that we have with our pharmaceutical benefit scheme. And our pharmaceutical benefit scheme is one of the wonderful things that we have in Australia. It's one of the great advantages of being an Australian. It's why people from all around the world seek to come to our shores, because of the advantages of our pharmaceutical benefit scheme. A scheme that started back in 1948 by providing free medicines to pensioners to prevent those life-saving diseases and to reduce illnesses and to reduce pain, Deputy Speaker. We've known for decades it's provided a timely, reliable and affordable access to the necessary medicines that all Australians need. So, Deputy Speaker, our challenge as a government is how can we maintain that going forward? How can we maintain that our children and our grandchildren have the same advantages of the pharmaceutical benefit scheme that we've enjoyed and our parents have enjoyed? So there's 3 specific problems, Deputy Speaker, we have to deal with. Firstly is the cost. Now, over the past decade, government spending on the pharmaceutical benefit scheme has increased 80%. This year, 2014, this federal government will spend $9.2 billion on the pharmaceutical benefit scheme. By 2017-2018, Deputy Speaker, that will be $10.3 billion. And the projections, Deputy Speaker, that this will go to $15 billion by 23-24 and then double in the next 20 years to something like $30 billion. So we have to come up with how we're going to fund those increases in costs. Now, what's driving those costs increase, Deputy Speaker? Firstly, it's the new drugs that are available. We've seen, Deputy Speaker, through the creativity and the innovation and the experimentation, the genius of mankind, we've been able to tackle many of the illnesses and diseases that our forefathers through thousands of years have had to put up with. Many of those diseases, Deputy Speaker, have been eradicated totally. Today we have the ability to cure those because of the geniuses that work in our medical research field. So already this government, Deputy Speaker, we've already committed for new drugs to be listed on the Pharmaceutical Benefit Scheme, $436 million. In March 2014, Deputy Speaker, another $550 million worth of new drugs are being released on the Pharmaceutical Benefit Scheme. And at their July meeting, we know the Pharmaceutical Benefits Advisory Committee are considering no less than $3.6 billion worth of new drugs to go on the scheme. Now, Deputy Speaker, I've had constituents in my office. I'm sure many of the members of Parliament have had constituents in their office coming in, pleading with us to get new drugs listed on the Pharmaceutical Benefit Scheme. New drugs that they feel and believe will help save their kids' lives or extend their kids' lives or make their lives better, Deputy Speaker. We owe it to all Australians to try to get those new drugs on that Pharmaceutical Benefit Scheme as quickly and as efficiently as we possibly can. But we know, Deputy Speaker, what happened under the previous government, how they held up for simply financial reasons. They had greater spending priorities and they held up many of those new drugs being listed on the scheme. So, Deputy Speaker, we know that these new drugs are coming on stream down the track. We know there'll be new drugs to tackle prostate cancer, to tackle bowel cancer, to deal with blindness and diabetes, Deputy Speaker. We as a government want to make sure that those drugs can be listed on the Pharmaceutical Benefit Scheme. The next problem we have, Deputy Speaker, is the ageing of our population. One of the great successes, or the spin-offs that we've had of all these new drugs and the creativity, has been the increase in life expectancy in this country. For those that value life and think life is the most precious thing, our forefathers have granted kids today a longevity of an extra quarter of a century of life. But with that, Deputy Speaker, we know that as you get older, the spending that is required with your age becomes greater. We know the Productivity Commission's report into revenue and expenses, Deputy Speaker, they found that for the Pharmaceutical Benefit Scheme, people aged 45 to 50 years, by the time you get to 60 to 74, the amount that you'll access or the amount that the government will have to subsidise through the Pharmaceutical Benefit Scheme will double. Double, from 45 on to 65 years of age, Deputy Speaker. And for health costs, Deputy Speaker, for someone aged 85, government spending on their health is actually 3 times greater than someone just aged 60 years. So, Deputy Speaker, these are the challenges that we have. How are we going to finance this? Well, we go back 6 years ago, Deputy Speaker, when we had a $20 billion surplus and we had $50 billion in the National Bank account. We could have drawn on those funds to help pay for this and finance this. But that was 6 years ago. Before, Deputy Speaker, this nation handed Julia Gillard and Kevin Rudd the national credit card and made them signatories to that national credit card. And we saw deficit after deficit after deficit, borrowed money after borrowed money, waste after waste. But Deputy Speaker, you know what? If you're wasting money and you're spending it recklessly, it's one thing if you're doing it with money you have in your pocket. But it's another thing if you do it with borrowed money. And that's what we saw over the previous 6 years of this Labor government. We saw them waste and recklessly spend money that they borrowed. So now, Deputy Speaker, we not only have the obligation to someday pay that back, but we have the ongoing obligation to pay the interest. And Deputy Speaker, that interest bill, this financial year, we have to find $12 billion. $12 billion we have to get, and we have to send 70% of that overseas just to pay the interest on the debt. That's $1 billion, Deputy Speaker, every single month. That's actually more, Deputy Speaker, than we spend on the entire pharmaceutical benefit scheme. The interest payments on the debt is more than the pharmaceutical benefits scheme spending. The $9.3 billion we spend this year, our costs to service the debt that these guys ran up is $12 billion, Deputy Speaker. These are the problems that we have to deal with. So how are we going to do this, Deputy Speaker? Now we know what the Labor and the Greens would do, Deputy Speaker. They would just continue to run up the bill on the national credit card, creating more debt, effectively stealing from our children, passing the bill on to the next generation. And why that is so unfair, Deputy Speaker, is that today there's many of the drugs that we enjoy which have a low cost because they're generics, because the patents have expired. Because previous generations of Australians had paid, and governments had paid the high cost for those drugs, which offset the development. So the patents have expired. Now they go back to a generic and they are very low cost, Deputy Speaker. So we've enjoyed the benefits. So going forward, Deputy Speaker, we simply cannot continue to borrow money against our children and run that debt up to pay for the pharmaceutical benefit scheme. So, Deputy Speaker, what is this government actually doing? This scheme, we're making some minor changes and some minor cost increase. For concessional co-payments, Deputy Speaker, co-payments which we hear Labor complaining about how terrible they are, when they forget, Deputy Speaker, that they were the ones that actually introduced the co-payments back in 1991. The concessional co-payments, Deputy Speaker, they will rise by 80 cents from $6.10 to $6.90. The general co-payment on the PBS will rise by $5 from $36 to $41.90. Now, Deputy Speaker, no one likes to pay a little bit more, but we owe it, Deputy Speaker. We owe it to future generations of Australians to make these small payments to ensure that the pharmaceutical benefit scheme stays sustainable. We owe it to our children, Deputy Speaker, to make sure that they can access and have access to these new drugs that come on board and get created by the medical profession, Deputy Speaker. We cannot delay the access of these new drugs. We want to see these new drugs listed on the pharmaceutical benefit scheme as soon as they possibly can. Because, Deputy Speaker, if we don't come up with a few more dollars in the pharmaceutical benefit scheme, the alternative is to hold back the release of these new drugs. To see Australians that could otherwise benefit from life-saving drugs and drugs that assist them with pain and improve their health remarkably and their quality of life, Deputy Speaker, what we would see, we'd have to hold those up and we wouldn't be able to give them to them, Deputy Speaker. And, Deputy Speaker, if we did that, we would be damned. So that's why, Deputy Speaker, that is the reason why I hope that members of the opposition support this bill. Because they know, Deputy Speaker, deep down in their hearts, they know that we cannot keep going on borrowing money to pay for this. They know that we have to have the pharmaceutical benefit scheme sustainable for the benefit of our children and our grandchildren, Deputy Speaker. Therefore, Deputy Speaker, I'm very pleased to commend this bill from the House, and I hope that when a division is called, that we have support from the members of the opposition.